the best way for caregivers to help patients is to ask questions and make sure they have open communication with them. The patient may need different things from day to day, hour to hour. They may need to be alone. They may want to talk with someone. They may just want a shoulder to cry on. So it's really important just to have that open communication and make sure the patient knows that you're available to listen and available to help whenever it's needed. There are a lot of emotions involved, a lot of anxiety. Patients often describe it to me as an emotional roller coaster with all the ups and downs, the good news, the bad news. It kind of can go all over the place. I think what caregivers and loved ones need to understand about the patient experience is that with a diagnosis like chordoma, which is very rare, it can feel extremely isolating for the patient. No matter how strong of a support system they have, it still feels isolating. So I think they just need to kind of realize that even though they're there in the experience also, the patient is the one really going through it. Some of the common challenges that I see among chordoma patients are isolation, pain, definitely, dealing with changing family roles. So making adjustments to their life and to their role in their family or in their workplace. Many patients, for example, have to stop working. That can greatly affect finances in the household. And so their role may change to a more of a housekeeping role or doing other things in the household that they may not have done before. On the other side of that, if they were previously a caregiver for children and they can no longer do that, they may have to fulfill a different role than they're used to. One of the most important things I think for chordoma patients and their caregivers to know is that mood symptoms, including anxiety and depression, are extremely common with this diagnosis and any rare cancer diagnosis. Why they need to know that is so that they can seek care as early as possible. So reaching out to your medical team, I know it can be uncomfortable to say, I've been feeling down, I've been feeling really stressed, or I've been feeling really anxious. But it's important to do that so that they can connect you with the appropriate resources, whether that's social work or psychiatry or supportive care. We really want to make sure that we're addressing the person as a whole, and quality of life is not just tied to your medical needs, it's tied to emotional needs as well. Caregiving can be extremely exhausting and overwhelming, both emotionally and physically. So we always stress self-care as, one of the top priorities for caregivers. You have to take care of yourself before you're able to care for anyone else. An analogy that I love to use with caregivers is the oxygen mask on the airplane. They always tell you to put your own oxygen mask on first before assisting someone else, and it's the exact same with caregiving.